It is not a good idea for everyone to get a hair transplant that might be interested in one. Today, I'm going to tell you about the hidden risks of hair transplant and the things you need to know to avoid if you are considering getting a hair transplant. Hair loss is a super common condition, and it's estimated that 50% of men and 30% of women by the age of 50 will experience some degree of hair loss. And so pursuing a hair transplant can be a life-changing step for many people, but if it's done by the wrong person or in the wrong place or by the wrong method, you could end up worse than where you started. We know that hair transplants can be super successful, and some of the biggest celebrities on the planet have had hair transplants, including probably LeBron James, Elon Musk, Jude Law, and many more. We're going to discuss the hidden risks, but at the end of the video, I'm also going to tell you what makes somebody a good candidate for hair transplant. And so if you're considering getting a hair transplant, make sure to watch till the end of the video to get all of those tips. In order to set the stage for who might be a good candidate for the hair transplant or who wouldn't be a good candidate, we need to look at something called the Norwood scale and the Sinclair scale. Stick with me, I'm going to make this super simple so that you can understand. When we look at men who have hair loss, we look at them and compare them on something called the Norwood scale, named after the doctor that described it, and we can take a look and determine how severe their hair loss is. You can see the Norwood scale here on the screen, and essentially as we start at a stage 1, we have very mild hair loss, and we progress up to a 7, where we have increased hair loss. It always starts here in the frontotemporal or in the vertex scalp, and as it progresses, we move on from one Norwood stage to the other. And depending on your genetics, you may experience hair loss in a different pattern, where maybe it's more prominent on the crown and not so much in the front. So when I decided to shave my head, I was probably sitting around a Norwood 3 or 4, but hair transplant was not something that I was interested in, and I personally wasn't good at taking the medication that you needed to take in order to keep my hair. Luckily, I had a good shaped head. The Sinclair scale is the model that we use for female pattern baldness, women's hair loss, and typically we're going to see women lose hair in a little bit different pattern than men. It starts with a widening of the part and diffuse thinning on the top of the scalp. So we move from lower on the scale to higher on the scale with more hair loss, a widening of that part, and seeing more and more of the scalp. But we don't tend to see that frontotemporal recession or just the vertex scalp recession. That's all I'm going to say about the Norwood and the Sinclair scale. There's a lot more resources, and your doctor can help you to understand where you're sitting at on that line. Now, if you are very significantly bald, like you're at the high end of the Norwood or the Sinclair scale, you're not probably going to have as much success in getting a hair transplant unless you have super dense hair on the back of your scalp. The next thing to understand before we get into some of those risks is the 2 ways that doctors will perform a hair transplant. Classically, we have FUT, or follicular unit transplantation, and we have FUE, which is follicular unit extraction, which is a newer method but not always the best for every single patient. Follicular unit transplantation, or FUT, is the classic one where they take a strip of hair off the scalp. It can be a small strip, or they can go from ear to ear, and it may be an inch, inch and a half wide, depending on how many hairs they need to harvest. The back of the scalp is sewn up and a fine linear scar is left on the back, and then the technicians that work for the doctor will dissect out each and every individual hair follicle unit, which may have 1, 2, or 3 hairs in each unit, and those are prepared to transplant into the top of the head. Follicular unit extraction uses a smaller tool to individually remove hair follicles in a random pattern so that you don't have a linear scar, but you have little hairs missing from all over the back of the scalp. And this can sometimes blend a little bit better if you want to keep a short hairstyle on the back of the scalp. But if you like to keep your hair long, or for women who tend to have longer hair in the back, that line scar is never going to show, and you can get more hairs to transplant by doing the FUT. Now, FUE is a little bit more tedious because you're individually removing those follicular units, and that can be done by hand, or it may be done with a robotic assisted device. And so that's one of the things we'll talk about when we get into the hidden risks of a hair transplant, when we start discussing some of the nuances of the harvesting. So let's jump into our first hidden risk of hair transplant. You need to understand that the hairs on the top of the the head are hormone sensitive. Particularly for men, these are sensitive to a hormone called DHT, which comes from testosterone. And when DHT hits those hair follicles, they shrink and eventually fall out, contributing to hair loss. The same process can happen in women, but they're not usually testosterone predominant. Now, the hairs on the back of the head and the sides, they don't have those same hormone receptors, so they don't start falling out with exposure to DHT, which is why you can transplant those hairs onto the top of the head and they retain that characteristic. They're not going to fall out in the presence of DHT. But usually if you're having a hair transplant, you still have other hairs on the top of your head that haven't fallen out yet. So if you're going to get a hair transplant, you have to know that you will need to take a medicine to prevent the hair loss of the existing hairs that are left on your head. And that's going to be something like finasteride or dutasteride. So before you go to get a hair transplant, you need to know that you're probably going to be on that kind of medication for the rest of your life, or as long as you want to keep the hairs that are already on the top of your head. So that is a hidden risk, because there are pros and cons to taking finasteride, which is a little beyond the scope of this video. But be committed to taking medication for the rest of your life to enjoy the success and results of your hair transplant. The next hidden risk is that many people do hair transplants, but not everybody is qualified to do hair transplants. You really want to seek out a surgeon that is certified by the International Society of Hair Restoration Surgeons, and I'm going to put a link to that society in the video description so you can do a search in your area to find somebody that has those qualifications. Some people will get into doing hair transplants because it is seen as a lucrative procedure. It's not uncommon for hair transplants to cost anywhere between $5,000 and $50,000 depending on who you go to and where you go to. And so if somebody just wants to make money, there are shortcuts to bringing hair transplants into your clinic and churning out a bunch of patients who are just going to pay a lot of money. If they're not certified and they don't know how to do the procedure in all but one way, then you are at risk for having an outcome that you're not going to be happy with. So how can you avoid going to the wrong surgeon? Well, search for your surgeon through the International Society of Hair Restoration Surgeons. Talk to other people who may have had it, see who they went to and if they were happy. And when you get to the office, there's a set of questions you need to ask that surgeon in order to know how good they are at doing that procedure. You can always ask what method they prefer to do the treatment by, and if they like FUE, that's great. If they like FUT, that's great. But you should be able to know that they can perform both types of procedures. If the clinic only does FUE and they don't ever do FUT, that could be a warning sign. But the next question you need to ask is, do you harvest the hairs by hand or do you harvest the hairs with a robot? And if they say, we only harvest with a robot, that again, not by itself is a bad thing, but then here's the next question you need to ask is, do you own the machine and employ the technicians that help run the machine and work for you? And if they bought or leased the machine, but they use a rent-a-tech program, rent-a-technician, so these are not their employees, they just come in maybe 1 or 2 days a month and help do this, that means that they are not doing this procedure frequently enough, in my opinion. They probably brought the machine in and they may just be looking at this as a revenue opportunity, and they don't know how to do the transplants in any other method. There are times when the robot can be used, but some of the harvesting may need to be done by hand. Or if you've had one type of hair transplant before, they can do the other type. So it's not necessarily bad if they prefer to do it one way 90% of the time, but if they do a rent-a-tech program, they don't have the machine in their office all the time, or the technician is not a regular employee, that could be a warning sign that you're not going to the right person. They should be a board certified physician. Most hair transplant surgeons are going to have a background in dermatology, plastic surgery, or surgery. There are some family medicine physicians who get into it, but you want to know that they're doing hair transplants usually 1 to 3 days a week. It's something that they're doing every week, and that hair is the bulk of their clinic. You don't want somebody that dabbles in it and does lots of other things because they're not committed to the craft of only doing hair transplants. Here's the next warning sign that you need to look out for. Does the clinic turn people away? And you can ask the surgeon this during a consultation. How many people come in for a consult that you tell them they're just not a good candidate for hair transplants? Because part of the training that you get in doing any cosmetic procedure is to be able to identify the right candidate who will have a good outcome from the work that you do and that the patient pays for. And this is not the same as turning somebody away because they can't pay for the procedure. You want a surgeon who has the integrity to look at somebody and say, I don't believe I can deliver the results that you're looking for. Maybe they have unrealistic expectations as a patient, or maybe they just don't have enough hair in the back of the scalp to be able to have a successful transplant for the amount of hair that they've lost on top. But a good surgeon knows when to say no. You should also ask if they know how to manage the most common complications and what those would be, because you need to know how to say no and you need to manage complications if you've been properly trained in doing any cosmetic procedure. Next up, you should not go to a hair transplant surgeon that doesn't know what kind of hair loss you have. It may seem obvious because most people do have androgenic alopecia, male pattern baldness, female pattern baldness. That's the hormone type of hair loss. But they should be able to look at your scalp and examine it under magnification to determine if you have a type of hair loss called CCCA or FFA, that's frontal fibrosing alopecia, or LPP, lichen planopilaris, or alopecia areata, because there are other autoimmune types of hair loss that if you have that condition, your hair transplant is much less likely to be successful because you have inflammation in the scalp that's literally attacking those hair follicles. And so if a surgeon just sees that you have hair loss, says, we're gonna do this procedure, but they don't examine your scalp, they don't confirm the diagnosis of male pattern or female pattern baldness, then they haven't done a thorough exam and they may not know what they're looking for. This next one may be controversial, but don't go to a foreign country to get your hair transplants. I just don't recommend it in any way. If you live in the United States, you can find a good hair transplant surgeon within a few hours of you, most likely. Maybe you have to get on a plane and fly to them, but I'm telling you that it's worth it to go to somebody in the United States who does this all the time. Plus, if you ever have a complication, they are much more available to help manage that complication or to take care of any potential side effects, or if you just don't have a great result, they can work with you on that. I have heard so many horror stories of people traveling to foreign countries to get a hair transplant done and they just don't get a good result. Maybe they show up and the clinic is kind of dingy, not clean, and they've already paid a deposit that they can't get back. And they feel pressured into getting the hair transplant because they're already there, they already lost a bunch of money on this. They might as well go through it in order to see if they do have a good result. And then they end up not happy, they've lost money, and they didn't get the results that they were looking for. I've also seen people go to foreign countries and have over-harvesting done. So if you're having follicular unit extraction, and they take 60% of the hairs off the back of your head, you're gonna start to look thin on the back of your head. And that can be a problem. If you take too much hair, you can actually get necrosis of the skin back there because the blood supply can be so disrupted. And when you see somebody who's had over-harvesting on the back of the scalp, it looks really bad. And that person, maybe they don't see it in the mirror every day, but it's not an outcome that's desirable. If you avoid some of these pitfalls that we've talked about, you're much more likely to have a great experience getting a hair transplant and enjoy those results for a lifetime. Hair transplant can have great outcomes. It's not without its risks though, so it is so important to research the physician that you are considering having do that procedure. Again, the International Society of Hair Restoration Surgeons will be the best resource to find somebody who's qualified in your area that does the procedure all the time. Like I promised in the beginning of the video, what makes somebody a good candidate for hair transplantation? Well, usually this person has identified the hair loss earlier and you have pursued medical therapy, whether that's topical application of medications or taking oral medications such as finasteride, dutasteride, or minoxidil. And you should be working with a physician who's comfortable prescribing those medications, can have a thorough discussion of the risks and benefits before you go on them. Usually, these people people have also gone through PRP treatments if you have had hair loss for a while. For the right patient, PRP treatments can be a great way to delay or prevent the need for a hair transplantation. It's not a procedure that works in everybody, and again, it's important to do your research on who is doing that procedure for you. If you're committed to taking the oral medications for the rest of your life, you are probably a good candidate for hair transplantation. If you have not experienced incredible loss over the top of your head and you have a good patch of hair in the back that the surgeon can work with, then you'll also be much more likely to have a good result. It is going to be more expensive to do it in the United States than traveling to a foreign country, but you'll end up paying more money if you go somewhere and have a complication and you need a revision that you then have to do in the United States. So understanding those things will help to make you a better candidate for hair transplant if you're considering that procedure. If you want to learn more about hair transplantation, I've interviewed 2 amazing hair transplant surgeons, and I've included a link to the video here. Make sure to watch that, and then you'll see the other one that pops up there as well. Dr. Jen Creechy is in San Antonio, Texas, and I send patients from Idaho all the way down to her. And Dr. Alan Bauman in Florida is another great resource who do nothing but hair treatment in their clinics and hair restoration surgery. So I can tell you that you're going to be in good hands if you go there. Let me know what questions you guys have about hair transplant. I may not have hair myself, but I understand all the physiology that goes into maintaining and preserving your hairline. I just like the way I look. Thanks for watching, and I'll see you guys on the next video.